Hello everyone, my name is Sneha Sharma and today I am going to discuss about HACCP in food industry. So now let us look at what are the topics we are going to discuss in this video. We will first start with the introduction, then we will look at HACCP as a preventive approach. We will know about the history of HACCP, the prerequisite of HACCP, the terminologies related to HACCP, the 7 principles and 12 steps that are involved in HACCP, implementation part of the HACCP, and finally the benefits of HACCP. Let us start with the introduction. We all know that food is a basic human necessity, and access to sufficient and safe food is the right of each and every individual in the world. Food safety is the major determinant of health. It affects the survival, well-being, livelihood and productivity of individuals and eventually the society. Now, WHO has defined food hygiene as all the conditions and measures that are required during production, processing, storage, distribution and preparation of food to ensure that it is safe, wholesome and fit for consumption. Now, the 5 keys to safer food that is given by WHO are as follows. First is keeping clean. Second is separating raw and cooked food. Third is cooking thoroughly. Fourth is keeping food at safe temperature. And the fifth one is use of safe water and raw materials. With the increasing consumer awareness about health and nutrition, ensuring food safety is becoming more and more important. Therefore, it is the responsibility of each and every food business operator that it ensures that their food is free from hazard and occurrence of any hazard in their food is properly managed. Other than the hygiene quality of food, other qualities of food include the nutritional quality, humanistic quality, organoleptic quality, social quality, symbolic quality, functional quality, which need to be maintained too for the consumer acceptability. To accomplish this, many approaches to food safety are being adopted by different food business operators, and one of the most common among these approaches is the HACCP. Now let us look at HACCP as a preventive approach. The acronym HACCP stands for Hazard Analysis and Critical Control Point, and it is one of the approaches that evokes food safety. Basically, HACCP is a systematic preventive approach to food safety wherein the physical, chemical and biological hazards are addressed and their prevention is aimed rather than the inspection of the finished product. It is an international food safety system that deals with the control of factors affecting the ingredients, products and processing of food. It has been widely recognized by scientific authorities and international organizations as the most effective approach available for producing safe food. HACCP provides a structure for assessing the risk, or it basically analyzes what could have gone wrong during the production of an article and then puts the control in place to minimize that risk. Now let us know about the history of HACCP. HACCP originated in 1960s when the National Aeronautics and Space Administration, that is NASA, the Pillsbury Company and the US Army laboratories collaborated together to provide safe food for the upcoming space expeditions. NASA did not want to risk the illness of an astronaut during a space mission, so it had very stringent microbiological acceptance criteria for the food that it provided to its astronaut. For this purpose, HACCP system was developed to assure 100% safety of the food to be used in the space. It was published in 1960 and documented in 1971 in USA. Based on its successful industrial application, it was endorsed by the WHO FAO Codex Alimentarius Commission in 1985 and it is currently being used widely all across the world. To provide the foundation for an effective HACCP system, certain properly applied prerequisite programs should be provided. These include the good manufacturing practices and the good hygiene practices. Good manufacturing practices is a system for ensuring that the products are consistently produced and controlled according to quality standards. The overall goal of good manufacturing practices in the food industry is to reduce the risk of contamination, the risk of recalls, and the risk of waste. Good hygienic practices are a set of requirements to prevent contamination of food in order to provide safe food to the consumers. It touches multiple aspects of the food industry that includes food supply chain, sanitation facilities, workers' hygiene practices, pest control, and preventing physical and chemical pollutants. Before knowing about the principle and steps of HACCP, we need to learn about certain basic terminologies related to HACCP. Now let us look at each of them one by one. First is hazard. Hazard refers to a biological, chemical or physical agent that is likely to cause illness or injury in the absence of its control. Second is contamination. Contamination refers to the exposure of food products to the hazard, which can cause illness, disease or even in some cases death. Third is control. Control can have two different meanings based on its usage. If it is used as a verb, it refers to taking all the necessary action to ensure and maintain compliance with the criteria established in the HACCP plan. And if it is used as a noun, it refers to the state wherein correct procedures are being followed and criteria is being met. Now comes the control measure. Control measure refers to any action and activity that can be used to prevent or eliminate food safety hazard or reduce it to an acceptable level. Then comes the corrective action. Corrective action refers to any action to be taken when the result of monitoring at the CP indicates a loss of control. Next is critical point. Critical point refers to any step at which biological, chemical or physical factors can be controlled. Now comes the critical control point or CCP. Critical control point is an essential point at which control can be applied so that a food safety hazard can be prevented, eliminated or reduced to an acceptable level. It is the last step in the flow of food where a hazard can be controlled. Then comes the critical limit. A maximum or minimum value to which a biological, chemical or physical parameter must be controlled at a CCP to prevent, eliminate or reduce the occurrence of a food safety hazard to an acceptable level. Finally, the last one is deviation. Deviation refers to the failure to meet a critical limit. Now let us look at the 12 steps and 7 principles of HACCP. Firstly, a HACCP team is assembled. Secondly, the product is described. Thirdly, the intended uses of the product is identified. In the step 4, the process flow diagram is constructed. And in the step 5, on-site verification of flow diagram is done. In the 6th step, a hazard analysis is conducted. In the 7th step, critical control points are identified. In the 8th step, critical limits for each critical control point is set. In the 9th step, CCP monitoring requirements are established. In the 10th step, corrective actions are established and taken. In the 11th step, verification of HACCP plan is done. And finally, in the 12th step, record keeping procedures are established. From step 6 to step 12, all these steps are considered to be the principles of HACCP. Now let us look at the implementation of the 12 steps of HACCP one by one. Starting with the first one, that is assembling of a HACCP team. HACCP team is a multidisciplinary team which includes representatives from production, sanitation, quality control, food microbiology, etc. It is the responsibility of the HACCP team to develop the HACCP plan. HACCP team should identify the scope of the HACCP system and applicable prerequisite programs. Second step is describing the product. A full description of the product for which HACCP plan is to be prepared is drawn, and the description includes the composition, structure, processing condition, packaging, storage and distribution conditions of the product, required shelf life of the product, instruction for use for the product, etc. In the third step, the intended usage of the product is identified and information is collected about who the end user or consumer is and where the product will be sold. This is done to ensure that if the product is being sold to any of the vulnerable group of society, it is safe for their consumption. In the fourth step, a flow diagram is constructed that covers all the steps in the production of a specific product. This flow diagrams includes all the inputs including the ingredients, food contact materials, water and even air. The flow diagram should be clear, accurate and sufficiently detailed so that the hazard analysis can be easily conducted. In the fifth step, on-site confirmation of the flow diagram is done by the HACCP team. The HACCP team confirms the processing operations against the flow diagram during all the stages and hours of operation. Any amendment in the flow diagram is done if it is required. In the sixth step, a hazard analysis is conducted. The HACCP team, using the flow diagram, enlists all the hazards that are biological, chemical or physical hazards that are expected to occur at each processing step. The preventive measures that can be used to control such hazard is described. In the seventh step, critical control points are determined. After the hazard analysis is conducted, critical control points are determined only for those hazards which are identified as significant. CCPs are established at step where control is essential and where a deviation could result in the production of potentially unsafe food. To identify a CCP, a decision tree approach may be used. When applying a decision tree approach, we need to remain flexible and use common sense to avoid unnecessary control points throughout the whole manufacturing process. There may be more than one CCP in a process at which control is applied to address the same hazard. For example, heat treatment may be the CCP for killing vegetative cells of a pathogenic spore former, but cooling step may be a CCP to prevent germination and growth of the spores. Similarly, a CCP may be used to control more than one hazard. For example, heat treatment can be a CCP that addresses several microbial pathogens. In the eighth step, critical limits for each critical control point is established. Critical limits determine whether a CCP is in control or not. In doing so, they can be used to separate acceptable products from unacceptable ones. The critical limit should be measurable or observable. In some cases, more than one parameter could have a critical limit designated to a particular step. For example, in case of heat treatment, commonly used critical limits are both time and temperature. Critical limits for control measure at each CCP should be specified scientifically and validated to obtain evidence that they are capable of controlling hazard to an acceptable level if properly implemented. In the ninth step, CCP monitoring requirements are established. Monitoring of a CCP is the scheduled measurement or observation at a CCP relative to its critical limits. The monitoring procedure should be able to detect a deviation at the CCP. Wherever possible, the monitoring CCPs should be continuous. Physical and chemical measurements are usually preferred to microbiological testing because physical and chemical tests can be done rapidly and can often indicate the control of microbial hazards associated with it. In the 10th step, corrective actions are taken wherever there is a deviation in the CCP. It is done to ensure that the CCP has been brought back under control and the food that is potentially unsafe is handled appropriately and does not reach the consumer. Details of the corrective action, including the cause of deviation and the product disposition procedure, should be documented in the HACCP record. Periodic review of the corrective action should be undertaken to identify trends and to ensure corrective actions that are effective. In the 11th step, verification of the HACCP plan is done. A verification procedure is developed to ensure that the HACCP system is working correctly. The procedure should include the frequency of verification, which should be conducted by a responsible and independent person. Example of verification include auditing methods, random sampling and analysis, etc. In the 12th step, documentation and record keeping should be established. The HACCP system requires efficient documentation and accurate record keeping. For example, hazard analysis, identified CCPs and their limits, including revisions if any, should be documented. Examples of record keeping are CCP monitoring records, records of deviation found and corrective actions taken on them, etc. Now let us look at what are the benefits of implementing a HACCP plan. The benefits of HACCP can be acronymed as safe food. Now let us look at each of them one by one. First is saves your business money in long run, avoids poisoning your customers, food safety standards are increased, ensures that you are compliant with law, food quality standards are increased, organizes your process to produce safe food, organizes your staff, promoting teamwork and efficiency, due diligence defense in court is ensured. From the discussion so far, it can be well concluded that increasing awareness and commitment to food safety and quality has led to evolvement of a number of proactive and preventive approaches to food safety. And HACCP is one of these preventive approaches. The HACCP concept was developed in 1960s as a system to ensure the safety of the food products. Its introduction signaled a shift in the emphasis from end product testing to preventive control at all stages of food production. The HACCP system was initially developed for use of food processor for preventing foodborne disease. However, the application of HACCP system has been expanded to form a basis for regulated food control and a standard for international food trade. If properly applied, HACCP is more economically efficient approach to food safety regulation than command and control interventions. These are some of the resources I referred to in making this presentation.